Well, howdy and welcome. Virtual Reality Medic here. Great question came in on TikTok. Um, the question was, can you tell me what are some of the long-term effects of hypertension on the body? I absolutely can. And for that today, we're in the anatomy room. So take a look around. Now, these are only a few of the anatomy assets that we have. If I put them all in here, this room would be pretty full, and it just wouldn't be a whole heck of a lot of fun. But come on back over. We're going to talk right here. We're going to talk about the human vascular system. Now, this is not all of the vessels that are in your body. This is just the major ones, and the reason is that if I had all the capillaries and venules and arterioles and all of those little things in here, this would basically just look like a human without skin and without muscle on it. So breaking it down to just what the major ones are, okay? Just what the major ones are. And for this demonstration, red is arteries and blue will be your veins, okay? So what is hypertension or high blood pressure? Well, high blood pressure, there's a bunch of reasons that it happens. But essentially what's going on in the body is that the pressure that it takes for your heart to pump the blood all around your body, pump it to every part of your body, up to your brain, all of that kind of stuff, it takes more pressure, right? There's an increase in the amount of pressure needed in order to get that blood to flow adequately to all of those tissues. Okay, and we are talking about the heart. Now, I had a little heart hiding there. Okay, it had a little heart hiding there. One of the long-term effects on the heart of high blood pressure is an increase in the size of the left ventricle. So the left ventricle is over here. Remember, when you're talking left and right, we're always talking about the patient, or in this case, the mannequin's left and the mannequin's right, okay? And so that left ventricle is going to get bigger. Well, so what? That sounds like a good thing. Means you got a bigger heart. Well, not really, because as that left ventricle gets bigger and bigger and bigger and bigger, it actually becomes less effective, okay? Because there's not as much snapback anymore. Think of a rubber band. As you're pulling a rubber band, right, you snap it back. You pull the rubber band, you snap it back. Pull the rubber band, you snap it back. You keep pulling it farther and farther and farther and farther, and you don't get as much snapback anymore. It kind of wears down all of the bits inside that rubber band. Well, that's kind of happening with the cells inside of the heart, is that the left ventricle keeps getting bigger and bigger and bigger and bigger and bigger, and that's not necessarily a good thing. That's what we call left ventricular hypertrophy. Now, some left ventricular hypertrophy is actually kind of desirable. If you're a swimmer or you're a runner or something like that, the left side of your heart is going to get a little bit bigger, but that's a normal increase in the left side of the heart. When it becomes pathological, or it becomes pathological when the heart really stretches just too far to where it can't really keep up with the blood flow needs. Now, another thing that can happen is that the arteries inside of the belly area, and that's where this is the belly button would be right about here, but the arteries inside of the belly button can also get some strain on them as well. Now, other arteries can as well, so like up here in the thoracic cavity, right, up there on the aortic arch, all of those can get an increase in pressure in them, but the ones down here in the belly are particularly susceptible to that, and that can cause an aneurysm. That can cause a growing area in that artery that is weakening, right? So that can cause weakening of the arteries, and we don't want that either. So how do we prevent it? Well, first of all, diet and exercise. We know that we gotta eat relatively healthy, and we gotta exercise as much as we can. And then, the other thing is that if you are on medication for high blood pressure, make sure that you are taking it as it is prescribed by your doctor. It's really, really super important. Many of those medications will be extremely helpful in reducing the amount of pressure on those arteries. So you get that. Another thing that can happen is that you can get pressure on the arteries that are going up to the head, cause a lot of headaches, those kind of things. But I'm thinking more long-term, less short-term. And I think one of the biggest problems in terms of long-term hypertension is what we talked about before, where this left ventricle is going to get much, much, much bigger and eventually become pretty inefficient. You'll also see some effects on the valves in the heart, and you'll also see some effects on the arteries that are going out to the lungs. Those arteries are really susceptible to higher pressures. So keep that blood pressure low. Keep taking the medication as prescribed by your doctor. It's what's best for you. It really is. And take good care of yourself. You know, take good care of yourself. So, hey, that's the virtual reality medic. I'll see you on the next one. You know, maybe on the next one, I should talk about how hypertension affects the kidneys. I mean, they're right over there. You can see them from here. Whoa, those are kind of cool. Heart's still my favorite.